are a lot of foods that people eat that are nothing remotely connected to the ketogenic diet that are worse than these, like sugar and grains. But I want to talk about some of the foods that people doing keto consume on a regular basis, as in dirty keto, and I want to talk about that. First of all, some people consider corn one of the vegetables, and they consume corn on the ketogenic diet, and they will consume maybe a little bit. Well, the problem is that most corn, like 95%, is GMO, and this is the big problem, in addition to the corn being highly glycemic. So you don't want to consume corn despite it being a vegetable. Now, yogurt has a lot of sugar, but some people consume the Greek yogurt, but you need to look at the label because you're going to be surprised how much sugar is in Greek yogurt. Now, if you're having a small amount here and there and you're counting those carbs, it might be okay, but make sure it's organic and grass-fed. But overall, it's still not a really good ingredient. All right, next one, commercial chicken. Unfortunately, the chicken is badly processed, factory farmed, fed grains. Overall, not the ideal protein you want to do on a healthy keto plan. All right, next one is processed meat. I'm talking about like cold cuts and things like that. Even though that would be considered keto, you have nitrates, you have a lot of added sugar. Sometimes they add monosodium glutamate, and definitely it's not grass-fed. So I'm not going to recommend this right here either. Now, cheese, I consume some cheese on a regular basis. So it really is the type of cheese, processed cheese, or not from cows that are grass-fed. I don't recommend that cheese. So if you're going to do cheese, I would definitely do grass-fed, organic, or don't consume it at all. But there's a lot of people that are sensitive to certain things in cheese. Cheese is originally from milk, and there are a lot of hormonal factors going on there that can influence someone with a prostate issue. Also, it can influence women who have problems with fibroids and cysts in the breasts or the ovaries. So if there's anything going on with estrogen dominance, I don't recommend it. And if you're going to consume it, I don't recommend consuming a lot of it. A little bit here and there. All right, spinach. The problem with spinach is it's loaded with oxalates. Oxalates can actually cause kidney stones. You might be okay. If you're not a stone former, you've never had a kidney stone, you're not having a problem, and you consume spinach, you may be okay. But what's interesting is if you consume some cheese, high quality cheese with the spinach, this calcium will bind with the oxalates in your digestive system, and it won't get absorbed into the blood, into the kidney. So the calcium in the cheese can protect you against the stones, FYI. But I just wouldn't recommend a lot of spinach. I would consume other vegetables. All right, nuts. You can definitely overdo it on the nuts, but almonds have the highest amount of oxalates. And if you have a tendency to get kidney stones, not a good idea. Some people that are arthritic should stay away from these as well, because you'd be surprised how many people that have arthritis really have just too many foods high in oxalates, which can irritate the joints. So if you're going to consume nuts or nut butters or even seeds, probably have just a small amount. It's really easy to do too many nuts, and that can irritate the gallbladder and the liver and the digestive tract. And the vegetable oils, it sounds really healthy, vegetable oils, when in fact this is really grain oils. They're usually GMO, highly inflammatory, but they're keto friendly because they're low carb and higher fat. So there you have it. This is the good list, and this is the bad. All right, thanks for watching.